Black and brown people, how women are diagnosed differently from our non-BIPOC counterparts.
Mhm.
I think that sometimes the decisions are faster about, oh, that person is this or that or whatever. And the notion of how far gone we are or whether it's true or not, like whether we're trying to get medication or, just things like that. I feel like there's distrust in the system and a lack of care, full on care for Black and brown people and women in the mental health spaces. So it's just a challenge to navigate. That's all I would say.
No, I'm doing my thesis on prenatal and postnatal and just care for Black women in
Hmm.
healthcare spaces for during their pregnancy, and the
Yeah.
research I'm finding of Black women, women in general, but especially Black women with these stories of, I was not heard. I vocalized what was happening and I was told, oh, it's just in your head. Oh, that's part
Right.
of the process.
Right.
And then an hour later, something happened to them where they lost the baby, or
Hmm.
the baby lost a heartbeat or something of that
Yeah.
nature. And I think a lot of times we're not listened to. And I'm speaking from a place of privilege where I have a college degree. I'm getting my master's and all
Hmm.
these other things, and I can find the access to healthcare.
Yeah.
But seeing other family members who don't have the privileges I have,
Right.
or
Right.
friends, it's very heartbreaking, and it's kind of like you ask them to trust the system sometimes, and sometimes the system doesn't have
Yeah.
their best interests at heart, which is very
I agree.
disheartening,
I agree.
honestly.
I really think that it's not made for the general public. And I have a doctorate and a master's degree as well. And when I had my daughter, I was young, not so young. I was going on 30, I think. And the doctor, the resident at the hospital during my labor just wanted to do some stuff to me that I knew that I didn't need to get done because my other doctor said that I didn't need to get that done. But he was like, you need to do this, you need to do that. And I was like, but no, I don't. And I'm an educated woman and worked in healthcare. So
Mm-hmm.
I, through my tears, I told him, no, the hell, you are not going to do X, Y, and Z because whatever. But I could just imagine how other people must feel when they're in those types of situations because I really felt like he was bullying me.
Mm.
And then I also think about like Serena Williams. Didn't she have like a major
Yep,
issue when
Serena
she,
Williams had blood clots. Beyonce
yeah,
even stated for herself that she had issues with her
yeah,
delivery with her twins. And again, and you live in Atlanta. My last interview was with her name is Alicia Hurt, and she's a doula
hmm,
out in Bainbridge,
hmm,
Georgia.
hmm,
And just like the quality of care and all the work and effort she's putting into making sure people
yeah,
are heard, especially
hmm,
like during delivery, because
right,
again, the communication is not fully there because the provider has their own mindset of what they have their own unconscious bias, unfortunately.
that's a big thing. And that comes into play in the mental health space as well. It's
Mm.
just bias. It's major, major bias.